Okay, my name is Grace Smith, and our PICO question was about CHG wipes and comparing them to soap and water basin baths. So our question is, in patients admitted to the hospital, what is the effect of using CHG on hospital-acquired infection rates compared with washing with soap and water within 1 month? Our population is patients admitted to the hospital. The intervention is using CHG bath wipes. Comparison is the soap and water baths, and the outcome is hospital-acquired infection rates. The value to our practice is that CHG bathing is an effective method to reduce the prevalence of HAIs in an ICU setting. Inclusion in practice will reduce patient readmission related to HAIs, decrease overall care costs, and improve patient outcomes. We're interested in this topic specifically due to the fact that we use these CHG wipes every day as techs or in clinicals and in the future as nurses. And it's really important that we're able to communicate and educate our patients on the importance of why we're doing what we do. And if they ever refuse a bath, that we know why we're doing it and we can explain to them the importance in order for compliance and in order to reduce the cost of care and HAIs. Especially because a lot of patients complain about feeling sticky after using CHG wipes. It's important for us to understand why that is and that they provide a protective barrier against microorganisms. And sometimes just understanding why that is can help someone to agree to take them. Our population, almost all of our articles included patients in the ICU that were there for multiple days. Around 48 hours for most of them. For Madison's article, the participants self-enrolled in the study, or sometimes they were on ventilators, so they gave implied consent, and doctors were able to ethically decide that this was important for their health. And if they had family members present, if they were intubated, then the family members could provide consent for them to be included in this study. And then ICU populations were selected due to their increased risk of acquiring HAIs because they're typically in the hospital longer. Let's see, they have a heightened risk of developing HAIs, especially with all the intubation and all the lines that they typically have.
Hi, my name is Madison Vernon. I'm going to go into a little bit of our interventions that we all studied through this project. So for us, 2 of the articles utilized 6 cloth wipes, which were filled with 2% CHG solution, and that was per bath, per patient. The CHG was not removed with any solution post-bath, which in my article, they did rinse with water after using the CHG solution. Those 2 studies were for about 6 months and 9 months interventions. My study was also around 9-month period. The other studies utilized a soap-like solution of 4% CHG versus the 2%, and that was followed by a water rinse, as I mentioned previously. All the baths were performed by trained professionals in the hospital, so it was usually 2 nurses who were taught step by step how they were supposed to wash the patient, rinse the patient, etc. And it was all done at the same time in the morning. So roughly 7:15 in the morning was how one of the studies was based. They did the same procedure and interventions for all patients, and patients were excluded from a daily bath if they had requested it or if they had broken skin. So any wounds or incision sites that were maybe left open after surgery due to implications, and any other condition or preclude administering CHG that day. Some other keynotes that I'd like to mention is that my study was based on 4% CHG wipes versus 2%, and It was predominantly based on 4% versus a standard soap and water bath. And they noted that with the 4% CHG, they saw better patient outcomes versus 2%. And 2% is what we universally stock in our hospitals today. So they wanted to make a note with the intervention that they used a stronger CHG solution. So with the comparisons, we saw that all articles consisted of soap and water baths versus CHG for the predominant study focus. Patients were able to opt out of the bath if requested, or like I said earlier, had broken skin, wounds, incisions, or any other conditions precluding them from being bathed that day. Some comparison periods mirrored intervention periods, and baths were again administered by trained personnel only. So nurses were the predominant caregivers of the baths in most of the studies, but that includes patient care techs and any doctor personnel that may have helped with the patient's care.
Hello, everyone. My name is Chris Messier. I'm another member of this group. So overall, the outcome across all studies reviewed in this session where we were looking at about a 50% reduction in HAIs. As Madison noted in the paper that she reviewed, when they used a stronger CHG solution, they did see an increased reduction in HAIs. So what does this all mean to you? Essentially, if you're not already doing it and your hospital is not already involved in this practice, it is highly recommended to use CHG wipes to reduce the incident of hospital-acquired infections. The majority of our papers also noted that device-acquired infections, there was a no decrease in the incidence in those infections. So if there was a 20% chance that you were on a vent and that you might have a ventilator-acquired infection, your chances were still roughly 20%, even with the CHG intervention. As this research was conducted solely in ICUs and with the patients that generally are administered there, follow-on research would need to be conducted to look at different avenues of the hospital where bathing may be required, as well as just other types of infection rates when looking at CHG. So we hope you've enjoyed our presentation. As we noted, our PICO question was specifically looking at the hospital-acquired infections while comparing the use of CHGs to soap and water, and if that reduced hospital-acquired infections. So these are the referenced articles if you would like to look up any of the information that we covered, and we hope you find this a valuable practice to add.
Okay, we all ready?